The Medicare annual enrollment period is underway, and Medicare eligible people have a lot to think about before they choose a health plan. While most weigh factors like cost and access to their doctors, few think about how personal health goals should impact their plan choices. Joining us today to discuss this is Christopher Ciano, the head of Aetna's Medicare. How are you, Christopher?
I'm well. How are you?
Good, good. I'm glad that you're here. Tell us, why is it so important for Medicare beneficiaries to set health goals?
Well, setting health goals is really critical for Medicare beneficiaries because it actually has them reflect on their own health and their own health status. And it gives them some motivation to actually think about how they could live a healthier lifestyle as they go forward. And according to a recent Aetna study, Health Ambition study, only 20% of adults greater than 65 years of age actually have a goal. And if they actually can establish a goal, then it allows us to actually build programs and services around helping them achieve that goal. Could be small or large, right? Could be running a 5K, could be spending more time actively with their grandchildren, or it could be wanting to travel and then making sure that they actually start to work towards achieving them.
So how can having a Medicare plan help people achieve their health and wellness goals, like putting that in place?
Yeah, I mean, Medicare Advantage plans actually take a total approach to health and wellness. They also cap out-of-pocket expenses in contrast to original Medicare. So it's important that when we think about providing services, we can actually offer through Medicare Advantage plans additional supplemental benefits. Things like access to transportation for doctor's visits, or even if someone's active and they want to think about fitness memberships. Many Medicare Advantage plans offer free access to fitness memberships like Silver Sneakers, which is a nationwide set of gyms that actually has programs designed around seniors. So it's very important to think about these other services. We have an Aetna Resource for Living program that actually brings community resources to our Medicare beneficiaries, and it might be around, food challenges or even financial challenges in their community, and help them understand how to use those resources better.
So how has coverage changed over the past year or so?
Yeah, actually, we've had a lot of change over the last 12 months because the Centers for Medicare and Medicaid Services has recently expanded the definition of medical services. And it's great news for Medicare Advantage plans because we can now offer more flexibility in the supplemental benefits that we provide. And an example of that is, for example, if someone is a little unstable and they need a grab bar for their shower so they don't fall, we now can provide that grab bar where in the past we could not. We can also provide non-skilled sort of aid services to bring into the home in case someone needs a little extra help in the home to remain independent and stay in the home. Things like ramps and mobile wheelchairs. So we have a lot more flexibility to allow members to be independent and continue to live healthy lifestyles.
Great. A lot of important information here. Where can people go to get more information?
Yeah, we're in the middle of the annual enrollment period right now. It runs between now and December 7th. And to get a lot of great educational information, they can go to aetnamedicare.com/learn. We provide how Medicare Advantage plans work. We provide a lot of information that helps Medicare beneficiaries decide how they choose a plan.
Perfect.
We also have all the plan features of the Aetna benefits on it as well.
All right. Christopher, thank you so much for being here. We really appreciate it. And we'll be right back with more Midday Maryland right after the break. Stay tuned.